ankles off. It's May. I only wear flip-flops from May to November straight. It's one of the good things about being here in LA. Okay, so we got our foam roller, and we've done this one a bunch of times already over the weeks, and we're going to do it again because it is effective, it is great, and it's going to be calf scrubbing. So we're eventually going to go side to side on our calf. You don't have to have a ton of pressure, it's kind of whatever you can tolerate. But I just want you to roll up and down first, okay? So we're just going to go up and down maybe like 10 times, and then I want you to pick some of those tender spots, and you're just going to give those a little extra attention, okay? Just going up and down, 8, 9, 10. And so I did go for a run yesterday, and my calves and my soleus are really, really tight. So I'm not going to put all my pressure down, but if you lift your butt and you cross your leg and you go sideways to help stretch and roll that muscle, you might get a little bit too much pressure, so you can back off. And I'm just going to go rolling here. And we're just scrubbing that muscle. We're providing a horizontal stretch to the muscle, something that it doesn't often get by just stretching or just by foam rolling up and down with the muscle fibers. We're actually going to go against the grain here, okay? You find those little tender spots and you give them a little extra love. So I got this one right here. You can tell by my face, it feels great. Now I'm going to switch. I'm going to go up and down about 10 times on this side too. A little more sore on this side. I drive a little bit harder with my left leg. It is my stronger leg. So my soleus usually gets a little bit more sore when I'm running. And deadlifting for that matter. When I deadlift, my calves get really sore. All right, and now I'm going to plop down. I can actually cross over on this one. Oof. Give it a little extra. Stay below that 7 out of 10 pain. You don't want to flare yourself up. The whole point of this is to make yourself feel better. So if you're like really tensing up, then just drop down and just go across the grain. Maybe even go side to side. Scrubbing that muscle, we call it. We're going to pop up on our feet in a second. We're going to stretch our calf muscles. And then, like usual, we're going to put it all together with a little bit of a mobility drill. A little bit of using our brain and our nervous system to kind of hit save on that document, lock it into our movement programming up in our brain. Okay. So normal calf stretch. Let's see here. Where am I in the frame? Here we go. Just going to put one foot back. You're going to keep your heel down and your knee straight. So we're biasing your gastroc muscle. The long one crosses your knee. So it actually attaches way up here in your hamstring. So you might feel a stretch all the way up here. And that's also your gastroc. Or you might feel a little bit lower. It's your Achilles complex. It's cool. It's great. Feels good. If you want to push on a wall, be my guest. If you need a stick to hold on to for balance, cool. We're just stretching. It's not a balance exercise. If you bend your knee a little bit, you might get a little bit more stretch if your soleus is tighter. I'm going to stick with the calf stretch on this side. Feels pretty good. I actually feel like my Achilles tendon is really enjoying this. And now we're switching. We got a lot of new stuff, some weird stuff for those hips because, like I said, we're working that frontal plane of our body. It kind of splits you front to back today. And so we don't work it a lot. And so maybe these exercises are unfamiliar. Maybe you'll say, wow, I never thought to do X, Y, or Z this way. And maybe you'll feel a little bit of stretch with our strengthening exercises that we're going to kind of loop into in a minute here. But as always, right now we're addressing the lower leg, the ankle, and the foot because we know that if you have restricted dorsiflexion, if you have a lack of ability to bring that knee over your foot forward, your shin forward, you're going to have increased stresses on the anterior front of your knee, and that's going to wreak havoc on your patellar tendon. Maybe you get jumper's knee, runner's knee, one various type of tendonitis or another. Okay, we're good. And all that's because we have restrictions in our ankles. Now this is going to combine a little bit of a hip flexor and quad stretch, but we're going to utilize that mobility that we just worked on in our ankle. Let's go this side. Okay. So you can and should tuck those toes in the back. Try to work on that mobility of the foot as well, because the big toe, just like the ankle, if it's restricted, is going to put increased force in that knee. From here, you're going to a big lunge, but I don't want you to lean back. Okay, the goal isn't to lean back. So if I keep my torso upright and I lunge forward, I'm still going to get a stretch on the opposite leg, and then I want to pitch forward with my ankle. I'm not flexing my spine, I'm not going here. I'm trying to get more dorsiflexion in my ankle. So I'm going as far as I can while keeping my heel down. I'm going to make 10 reps and then switch. There we go. Really getting into it. You might feel it in your hip. This is like a precursor of things to come for that hip that's getting a stretch. Just because we're working frontal plane today doesn't mean we can ignore the hip flexors or the glutes, especially because the glutes work that frontal plane a lot. If your glutes don't work well, you're running a risk of increasing your chances of spraining your ankle, and we'll talk about that in a minute. Now we'll switch. Tuck those toes and back. There we go. Nice lunge, feeling a stretch in the front of my hip, squeezing my butt, torso's upright, pitching forward. 10 times. If I stopped here, I would feel great, but we have a long way to go here. We got 9 more things to go. And they're all good. They're all working that frontal plane mobility, flexibility, and stability. Helping our hips and knees feel healthy. Stuff is going to be really good for your back and your ankles too. All right. Now we're not done with our foam roller. We foam roll our calves. We're going to get our foam roller. We're going to use that as a little chair. We're going to foam roll our glutes a little bit. So you're seated on one side. So I'm sitting on my right side. I'm crossing my right ankle over my left knee, and then I'm just hitting those rotators of my hip. Okay, people say, oh, I'm rolling out my piriformis. You got 6 other muscles in your hip that do almost the exact same thing as your piriformis muscle. So to say I'm rolling your piriformis, yeah, you are, but you're also rolling a lot of other stuff. And you're going to be getting your glutes. Just providing a little bit more of a stretch, and then we're going to help them relax with the roller, and we're going to get into some pigeon pose to stretch them out, and then onto a frog stretch for our inner thighs, but then we're going to put it all together with a Cossack squat. So you have a preview of things to come. It's about 10 or so. So I'm going to switch sides. All right. Oh, there we go. Crack, pop. And just going right over that butt muscle. Providing a nice little stretch, a novel stimulus to the muscle, getting it to calm down a little bit. Maybe you've been squatting, swinging, jumping, swimming, whatever it is you've been doing this week. You need a little bit of recovery, a little bit of relaxation in that posterior hip. Maybe it feels great. Maybe it feels a little tense. Try to keep it below a 7 out of 10 because we want you to be able to eventually relax, get a little bit more range of motion in that hip. Especially when we're putting it all together with your Cossack squat. Even later with this other new type of squat. Some of you are probably familiar with it. It's called a curtsy squat. It's really good at taxing that frontal plane of movement. Okay. We're going on to our pigeon. I'm wearing shorts today. It's a little warm in here. I probably could turn the AC up. But we got one leg in front, one leg in back. Sinking into that hip, keeping your chest up so we get the movement in our hip, not in our lumbar spine. And now that you're here, as I always say, you're stuck here for 1 minute. Just relax into it. Just breathe. Enjoy it. But if this is bothering your knee, you have a couple other options. You can flip onto your back and just pull your knee up and across your chest, just stretching out your posterior hip, your rotators, your glutes, all the stuff that you were stretching before or rolling before with the foam roller. We're just hanging out here, and once again, we're not treating anything specifically, but we're just gonna make all those structures in your hip and your knee and your ankle healthier, so you're kind of preventing yourself or reducing the likelihood that things are gonna kind of irk up or like really start to bother you. If you do have something going on, please reach out. Hit me up in my direct messages, and maybe I can help you out. We got about 5 seconds left. Maintaining, trying to progress our mobility, stability, control, flexibility, all that stuff, so we can stay healthy, because it's a lot easier to stay healthy than to get healthy. We want to stay ahead of these things. It doesn't take a ton. Earlier in the week, I posted something. It's 20 plus exercises you can do at your desk every 30 minutes. Sneak them in, add that movement into your day. It can make a huge impact on the amount of activity you're able to do, more than just exercising for an hour a day or going for your walk or whatever it might be. You can also maintain your orthopedic health as well. We got about 15 seconds left here before we go into our frog stretch, which is going to stretch our adductors. Your adductors are a busy group of muscles because they help flex your hip, they help extend your hip, they control abduction going out to the side, and then they pull your leg back in for adduction. And yet they get no attention. They get barely any attention. People are starting to finally come around to this thing called a Copenhagen squat, or excuse me, a Copenhagen plank. We're not doing it today. You need a bench, you need a step, that kind of thing. That's for another time, when maybe we need a little bit more equipment. But for now, we're going to do a nice little frog stretch. So you're going to separate your knees as far as you comfortably can. I want you to kind of lay your feet flat. You're going to push your hips back. Let's see here. You're going to push your hips back a little bit. You're going to just drop down onto your forearms. And this is it. Once again, we're just hanging out here for a minute. And then we're going to put it all together finally with that first version of a squat, the Cossack squat. We did these guys, I think, last week. They're great at utilizing the new length in our adductors that we're getting here and the length in our glutes that we've been getting from all the foam rolling and the stretching. So get to put it all together. Just here for a minute. I don't know when we started, so I'll say we got about 20 seconds left. Why not? Just breathe in. If you feel like you could separate your knees a little bit more, be my guest. Get a little bit more stretch. Everybody's got their sweet spot on their stretches. Maybe you want to push your hips back towards the back wall a little bit more and then go forward and back and kind of ease into a little bit more range. We have 6 adductors, so if you flex your hip a little bit more, if you extend your hips a little bit more, you're going to be biasing different muscles. All right, now we get to put it all together. So we're going to go wide with our feet, wider than shoulder width. Now I want your feet to remain forward, okay? So we're going to imagine that we have a stool behind both heels, so one back here and one back here. And our goal is to touch our butt from stool to stool while keeping our opposite leg straight. So I'm going to sit back, chest is up, and then I back up to the middle, and then I sit back. I'm feeling that big stretch in both the the middle, median portion of my hip, but also the back glute. All those things that we mobilized and stretched and rolled, now we're using them. Using them through range of motion. Gotta make sure my wife isn't texting me. We got one more to each side. Using the ankle mobility too that we started with. All right, so now we got some weird stuff coming. We got something called hula hoop. There we go. All right, so you can see a little bit more in here. Sorry, we're going to do lateral hip shifts before we do hula hoops. Both address, once again, that frontal plane, the coordination of our pelvis and our legs moving together, because we're going to be doing some more lateral stuff later on. We're going to put more squatting into the program with our curtsy squats. So you want your feet roughly about shoulder width apart. A little wider won't hurt. Hands are going on your hips. And you're just going to shift your weight from side to side. Now you have to imagine that you are stuck between 2 panes of glass. And so when you go side to side, as I am, you're not bringing your hips forward, you're not bringing your butt back. You're just going side to side. what you might feel is like, whoa, I'm a little bit more restricted on one side. Like I can push my weight a lot more to my right because my left adductor is a little bit looser. And then when I go this way, I'm kind of stuck. And I know that I have a lot of dysfunction in my right hip. Not a lot, but I have some. We're going to go side to side. We're just working on the coordination of our lumbopelvic region, so our low back, our pelvis, and our hips. And we're going to go for 5 more on each side. A little bit of a stretch. We just use that range of motion with our Cossack squat and our frog stretch. Getting ready for these guys. And now also, you might be suffering from some low back pain. And as you're doing these, you might say, oh, wow, I really am lacking that range of motion. And wow, I have pain on that side of my back too. Well, maybe there's a relationship there. Maybe you need to be working on your abduction range of motion, working on the length of those adductors. All right, now we're going to progress this just a tiny bit into an exercise called hula hoops. Now we're making big hula hoops. So we're going to be making big circles with our hips. So we're going to be having one hip is going to be internally rotating, the other is externally rotating. One will be, and then they'll both be flexing and extending, and they're all over the place. And we're doing it with an exercise that kind of looks a little weird. If you have anybody else in the room with you, make sure you make eye contact with them as you do it. So you're going to have your feet, once again, about shoulder width. You're going to shift your hips to one direction. Great. We just did that. But then you're going to lock your knees out. You're going to push your hips back. And then you're going to shift to the other side. And then forwards. We're going past that neutral position, okay? I'm still braced in my trunk. I'm not putting too much pressure on my low back with these. We're going to make 5 in each direction. So really push your hips back. Feel those hamstrings stretch and pull. And then your adductors and my outside of my hip. And then everything kind of switches. Now it's my adductors. It's the outside of the other hip. And then it's my hammies. And we're going to make two more in this direction. You see I'm not going fast. Now you see why you want to make that eye contact with people. And we got one more. I had a soccer coach in middle school who used to have us do these. Now obviously we were the boys team, and then the girls team would literally be practicing like right next to us. And we'd all be like, don't look at us. Why is he having us do this? This is embarrassing. But the guy knew what he was talking about, getting our hips ready. Lots of hip rotation involved with playing soccer. I got some strange R&B going on in the background. It's perfect for this. I think I got 2 more. Feeling that hamstring stretch, feeling those adductor stretch. And then we are popping down to a favorite of mine. All right, we're going to a hip flexor stretch. Yes, a hip flexor stretch does have a time and a place when we're talking about the frontal plane. There is a little bit of rotation that occurs with using our hip flexors. So I threw it in here because it's a favorite of mine. But we're going to change it a little bit today by adding some more rotation in our trunk to get a little bit more stretch. So you're going to tuck your toes underneath and back because why not? Great toe mobility, big toe mobility is very important for your knee, hip, and back health as well as your ankle and foot. Let's see, how do I want to do this? I'm going to switch my knees around so you can see a little bit better. I'm going to take my hand, I'm going to take it to the outside of my front leg. Now you might be getting so much of a stretch on that hip flexor that this is where you stop. But we know that there's a way to progress it, and that's by grabbing with your opposite arm. This is opposite arm, usually it's the same side arm. And I'm just pulling up. Just breathing, getting a nice stretch. I'm putting my hip flexor, my iliacus, and my psoas on a little bit more pull by doing the rotation away from that side of my body. And I'm just breathing. It's not a balance exercise. If you need to hold on to something, be my guest. Got about 25 seconds left. Just hanging out. Once again, we're talking about frontal plane exercises. This would be something more in the transverse plane because I'm getting so much rotation in my body. But we're just, all of our movements that we're doing throughout our day are usually a combination of 2 or 3 of these planes of motion, which we covered at the very beginning of this lab. All right, now I'm going to turn around. doing the same thing. So I got toes tucked under and back, setting my hips, posterior pelvic tilt, coming up, hand goes on the outside of the opposite knee, grabbing my opposite foot if I can. If not, just keep that foot down and keep stretching your hip flexor. This is going to get me a little bit more of a quad stretch. We've got 1 minute here on the clock. And then we're going to go from a lunge position into, once again, a lateral hip stretch. You're going to stretch both outsides of the hips with one stretch and then turn it around and do the same thing on the other side. I'd say that if I had just gone for a run and wanted to stretch after, today's the day. This stuff is amazing at stretching out all your hips, your quads, your back, your ankles. We're covering it all today. So if you or anybody you know is a runner, maybe pass this one along. Got about 10 seconds left. I'm sweating bullets here in my polo. Just got done filming a bunch of shoulder stability exercise videos for y'all. Okay. So, this next stretch is going to stretch the outsides of both hips. One is going to be a little bit more on the vastus lateralis, one of our quads. And the other is going to be more the glute complex. We have 3 glutes, and this is going to just stretch all 3 of them, okay? To set this one up, you're going to step forward. Big step, big lunge. I'm going to take my front foot and I'm going to turn it towards you guys. So I'm going to turn it out. I'm going to do the same thing with the back foot. I'm going to put my hand down on the ground. And this is my stretch. So I'm feeling a big stretch in my glute. If I can roll onto my foot and back, I'm going more there. I'm trying to drop my bottom hip to the floor. And we're just hanging out. If you can't hold on this long, you can switch and go to the other side. I'm going to hold this one for a couple more seconds before we go on. We're going to go back and forth a couple times. So I'm going to turn it around. All of a sudden, my other foot's in front. That's magic. Rotate my hips. Keep my back leg straight. Stretching on the outside of my top hip, the outside of my bottom hip. Just supporting. And I got to say, this feels pretty good. It's difficult to hold it because I'm a little tired. Just worked out with some kettlebells for a little while. We're going back to the other side, turning everything. I'm on the outside of that bottom foot, leaning my bottom hip towards the floor, stretching everything out. Switch again. And I think we'll get one more on each side after this. Really stretching that glute, stretching that vastus lateralis, the outside of my leg. I'm not stretching my IT band. It's almost virtually impossible to stretch your IT band. That sucker can withstand thousands and thousands of pounds of force for hours and hours and hours before it will even budge a smidge. And by a smidge, I mean even a millimeter. It's not going to stretch even like a millimeter under thousands of pounds of force. So your little stretch that you're doing isn't going to stretch your IT band. But what you might be doing is stretching the muscles that feed into the IT band. Now, isn't that something to think about? So we're stretching those muscles, your TFL and your glute medius, and then all of a sudden your IT band might start feeling a little bit better. This is our last one, just hanging out, and then we're going on to a bridge. All right, and I'm going to tilt the camera down so you guys can see my bridge a little bit better. Here we go. Look at that map, that's beautiful. Okay, right there. Brother's trying to get in this video. We gotta actually say 1 minute. We'll wait till the end here. So we're working on our bridge. We're going to be using our adductors again, using our glutes, going through abduction range of motion. So once again, this might go back to these guys, the limitations that you felt in your hips. But you're going to be on your back. You're going to bridge your hips up nice and high. We're going to do 8 of these on each side. Bridge your hips up nice and high. You kick your leg straight and you reach it out to the side. So from the back, looks here, from the front, looks like this. And there's 1. So you go up, you do each side, then you go down. You're doing 8. So there's 1 from 8. It's a great trunk stability exercise as well. If you're having back pain, help with that. Maybe you have difference on each side. It probably correlates to whatever restriction you felt with your little lateral hip shift. You got 2 more left on each side, trying to not allow any rotation in your hips. Last one coming. All right. And we are on to our last exercise. Okay, here we go. So, last exercise is a curtsy squat. This kind of puts everything together in that frontal plane, that plane that splits us front to back. To do this, just so I'm going to take my right leg, you're going to slide it behind you, you're going to put your foot back down, drop down, then you're back up. We're going to go 5 of these on each side and then we're done. Slide behind, touch your knee down, and you're done. And if this bothers your knee, just do regular squats. They're good. They're not going to address as much of the frontal plane as I hope with this, but that's okay. 3, we got 2 more to go. So I'm having to stop myself with my glute from going sideways. 4. Just like when we're cutting and running on the field or the court, whatever it might be, if we don't have good glute control, we're going to require, I guess I'll do one more. We're going to require our ankles to try to stop us when we go to cut. If we don't have the control on our hip, what's going to happen is our weight's going to shift. We're going to turn our ankle inverted, and then we're rolling our ankle. That's how I got into physical therapy. I appreciate you wanting to empathize with me about the ankle sprain, but let's reduce our chances of rolling our ankles by getting nice strong glutes in that frontal plane movement. So now I'm working my right side, sliding behind with my right foot, down, back up. Always pushing through that front leg. 2, 3. Got 2 more, and we're done. 4, 5. And these ones are really good with weight. You are gonna feel those in the next day if you load those up.